Inside Science.
What do concussions look like to doctors? What is a concussion? The precise definition still eludes us in many ways. A concussion is a type of traumatic brain injury, and a good clinical definition of a concussion is a trauma-induced alteration in your level of neurologic functioning. But what does that mean exactly?
In simple terms, a concussion is when a blow is sustained to the head that manifests itself in some form of consequence, whether that is a symptom that's precipitated or whether it's an actual neurologic deficit that arises from that blow to the head.
That could be a direct injury, in other words, they get hit in the head, or it can be indirect in that their body moves in such a way that the head moves around in some sort of shaking motion that disturbs the functioning of the brain. So if there's any sort of trauma like that, that then results in headache, changes in the way you're thinking or functioning, sensitivity to light noise, etc., that can be defined as a concussion.
Many people link concussions to a loss of consciousness, but Proctor said that's actually the minority of concussions.
10 or 15 years ago, even physicians thought a concussion was a loss of consciousness after a blow to the head. And now most physicians know that's not the case, that you don't have to lose consciousness. And even most players and families know that that's not the case.
Today, doctors like Proctor consider concussions to be functional injuries. They are not defined by what a doctor sees in a brain scan, but rather how someone is doing after suffering an injury to the brain.
By and large, if you do a CT scan or MRI scan, it's all going to look fine. So the basic structure of the brain seems to be fine, at least on any external or obvious level, but there's a disturbance in the way the brain functions. So the brain is sort of like a complex electrical circuitry, and the disruption caused by the concussion and shaking of the brain temporarily alters that circuitry.
The good news is that while efforts to better understand, evaluate, and treat concussions still have a ways to go, they are already bearing fruit for the benefit of patients of all ages and backgrounds.
So at this point in 2017, it is quite easy for someone who has sustained a concussion, whether it is by participating in a sport, whether it's by slipping and falling down the stairs while you're carrying the laundry to the basement, or whether it's just riding your bike around the neighborhood. We now have many avenues for people to engage with an expert in the field of concussion and undergo a proper evaluation.
This is Inside Science.
Inside Science. If you enjoyed this edition, follow us on the web and social media. Powered by the American Institute of Physics and a coalition of underwriters.